Hi, I'm Nick Torrance from Balance and Motion Physio here in Bondi. Today we're going to be talking about how to treat forefoot injuries. Okay, so we're going to talk about metatarsalgia and the management for it now. So basically, metatarsalgia happens when you have any disruption or alteration to the stabilization mechanism of your metatarsophalangeal joints. So on the top of the stabilization mechanism, you've got your extensor hood over the top of the joint, and that has attachments with your long toe extensor and your short toe extensor. And underneath you have your plantar plate on the bottom surface of the joint. Now that has attachments with your flexor digitorum longus and brevis coming in to attach into the stabilization mechanism. And interestingly, there is a slip from your extensors to your flexors. So essentially, the whole joint moves as one unit. So any disruption to your flexors or your extensors, say for example, if your toe flexors are in a weak, shortened position, or your toe extensors are in a lengthened, weak position, then that's gonna basically disrupt that extensor mechanism, stabilization mechanism. So what tends to happen in metatarsalgia is the MTP joint goes into extension. And when it goes into extension, what we see is that the metatarsal head drops and starts to take all the weight. And eventually, with constant impact, it starts to bruise and swell, and then we're left with pain and an inflammatory process. The only other reason that you can get metatarsalgia is with a hallux valgus deformity, which we're going to talk about soon, and that's when the valgus deformity starts to push into your second metatarsal head, and that starts to create a lack of space, and the second and third start to drop. Okay, so someone comes in with an acute presentation of metatarsalgia. The first thing you might notice, if it's acute on chronic, there might be a whole lot of callus thickened skin under here as the transverse arch is dropped. Second thing you're going to see is, it's generally the most common is your second and then your third met head. So you're going to see your first MTP might be up and your second and third might be down. So Carl is a classic example of this. You can see this transverse arch here, and you can see this drop of the second and the third. But in the acute setting, what you're going to find is that there'll be a whole lot of obvious swelling going on around the metatarsophalangeal joint and the met head, and it'll look very different to their good side. So the first thing you need to do is you need to settle down that inflammatory process. So I tend to get them to ice daily for about 7 to 14 days and encourage them to gently rub some Voltaren Emugel and some Hirodoid swelling cream around this area here, and gently apply Glad Wrap. Now obviously you don't want to apply the Glad Wrap too tight, because that's going to compress and accentuate what we're trying to do. Because essentially what we're trying to do is create space in order for this transverse process to be restored and the swelling to settle.